Hi, this is Dr. Otto Janke. Thank you for being with me on the Empire Longevity Podcast. Tonight, the week before the presidential election in the United States, we're going to take a look at the healthcare policies, the strengths and the weaknesses of the policies of the presidential candidates. I think it's very, very interesting to look and listen to our candidates, Vice President Harris and previous President Trump. And we're going to find out. I think it's very, very interesting to listen to what they say. More importantly, what they don't say. I think it's fascinating to hear what the candidates do talk about. And then you listen to what they don't talk about or what they never bring up. Very, very interesting. I'll be jumping back and forth as to the candidates. And in a real short period of time, I'm going to give you my grades of their two healthcare policies. I want you to understand something that in 2020, well, when Trump came into the seat, the seat, he wanted to totally eliminate Obamacare. If you had looked on their site, on the Trump site, when he came into power, you would have found out under the healthcare policies, one of the top thing was to totally eliminate Obamacare. Here's the ironic part. I have no problem with that. I have no problem that one candidate wants to eliminate the policies of a previous one. Presidents do that all the time. Harris will get rid of policies, ironically, that she put into play with Biden. That will happen. They will talk about that and they will disguise it and they'll spin it. And that's okay. That's politics. But Trump wanted to, when the key things was to eliminate Obamacare. He hated Obamacare, thought it was wasteful, wanted to totally get rid of it. And again, I have no problem that a president wants to do that. And we have presidents to do that all the time. We're going to get rid of that policy. It's stupid. Got to get rid of it. It's super expensive. We're wasting money. Let's get rid of that. My big, big problem with what Trump wanted to do was he wanted to eliminate it, but he had no plan to put something back into play. He wanted to eliminate Obamacare, but he had no plan to put something in. He said he's working on it. Big problem with Trump is he had 4 years to do that, and he didn't do any of it. Half through, as politicians spin, he said that they actually changed some of the stuff. What they actually did was they actually built upon Obamacare. They actually fortified it. They will never tell you that. Obamacare is in play right now, what we call Obamacare. What's very, very interesting about Harris is she wanted to go for a Medicare style, Medicare for all. That was her style. I got to tell you, being a practicing chiropractor for 32 years, I don't see the benefit of a Medicare for all. I mean, I kind of do, in that you can get down to one thing, you know what's going to be like through everything. So you know what it is when you go to practitioners, but she doesn't stand for that anymore. Now she's full-fledged. Let's go Obamacare. Let's go Obamacare. So there's going to be numbers of insurers nationwide. At one time, she wanted Medicare for all. One style. And now she says, well, let's go to pushing and making strengthen Obamacare. So she switched a little bit on that. I have no problem with that. As Trump campaigns for another term, he has said he would replace the Affordable Care Act, Obamacare, if a better plan is devised, but he would, quote, run it as good as it can be. Again, one of the big problems that I have with the Trump presidency was they had 4 years to put a plan into play, and they didn't do it at all. So once again, we have a presidency. He's running on this. He has what was the concept of a plan? Is that what he said in in debate with Harris? He has a concept of a plan. Again, I'm not here to be critical on Trump, but if you're going to if you want to eliminate that, if you want to blast this out, then you got to put something in it. If you're going to dig the ditch hole and eliminate this whole thing over there, then you got to fill it with something. You can't just allow it to be empty. And as someone who is not only a provider, I am a user of healthcare, but I'm also a provider. And so I'll be honest with you, sometimes I get screwed twice on this. That's just that's the honest truth. Harris will say that she also about this. For some of you who say that about COVID, understand that it was under the Trump administration that the COVID vaccines were allowed to be warp speed. Remember Operation Warp Speed, where they were going to let's get these done as quickly as possible. So it was actually under the Trump administration, which allowed for literally the non-testing of vaccines. How do you feel about that? Under the Biden administration, which Harris was part of, they pretty much gave up. They said a number of times, "We really don't have a plan." States, you're at your own on this, which was amazing. I kind of like that RFK Jr. is with Trump. I kind of like that. I like it because he is very much, let's get America healthy. He's not MAGA. Was it MAGA? I don't know what that is. MAGA, make America healthy again. He's not anti-vaccine. He's anti-mercury in vaccines. He's anti the stuff that makes the vaccines massively toxic to you. I mean, there's many things in vaccines that make it toxic to you. But one of his big things that he was against in vaccines was mass amounts of mercury within them. He was big on that. And so when people say that he is anti-vaccine, he's not. He's let's clean the stuff up so it makes it cleaner so your body doesn't go into, has to fight that also. I liked RFK on a number of steps. So I'm kind of happy he's with Trump on that. It doesn't mean it's going to be useful or it's going to be into play by any means. I mean, that's just reality. They both want to bring down healthcare costs. And Harris has waved the flag that under the Biden administration, she says, we did all these things. It's always we. Is that they want to bring down the cost of prescription drugs. And you remember the time when Biden was on TV and he said, we kicked pharma's ass. We kicked pharma's ass because they brought down for 10 medications, they capped the prices on those, which was fantastic. But the question is, why did they have to do that? Canada has lower prescription prices than America does. Numbers of countries, foreign countries, have much lower prices on their prescriptions than Americans do. It was years ago, it came out on a 60 Minutes show that like the federal government wasn't allowed to go into contractual negotiations with pharmaceuticals. They weren't allowed to. Why not? Who wrote that? Who was getting paid off by Big Pharma? Who was already writing that legislation? The Trump administration paved the way for states to import prescription drugs from Canada, as President Trump also tried to tie Medicare reimbursement for certain drugs to the prices paid by other countries, although that effort was blocked in court and ultimately rescinded during the Biden administration. Only what I'm reading. I'm not quite sure where that goes or how it does. Trump created a demonstration program that limited insulin copays to $35 monthly for some Medicare beneficiaries. The Harris administration has talked. Harris has talked about while she was with the Biden administration that they got 10 of those drugs to be capped, much lower, and that they're going to work on many more. Harris has also made eliminating medical debt a focus. As vice president, she worked on removing medical debt from credit reports. How about instead of removing medical debt from credit reports, how about we don't have medical debt? Yeah, I know that'd be quite a dream, wouldn't it? I find it also very interesting. Again, bringing down costs of prescription drugs is quote the one area in healthcare where they seem to agree, but how that would translate into specific policies is somewhat unclear. How they would go forth and do this. What you find amazing about both of these candidates, you talk about bringing down prescription prices. I'm all for that. Once again, America pays exorbitantly higher prices than other countries do. Massively higher prices for the same damn drug. Why is that? Because the pharmaceuticals do it that way. Well, if you knew you could sell a car over there for $100,000, but then you got to sell over there for $1,000. Of course, you don't want to sell it for a lot more, those 100,000 times. Here's my question for you. I'm gonna get to. Let me come back to this step point. Is of course, Harris is running dramatically on very hard on reproductive rights. Trump will tell you that it's exactly the way it should be. That the states are the ones who should be garnering the command of what happens in their state and not have a national thing. Harris says, no, it should be a national thing. There should be an opportunity for reproductive rights, reinstituting full Roe v. Wade. Okay, great. I don't know how you believe on either one of those, but it's very interesting. Trump says it's exactly where it should be at. And Harris says it's not even close. It's not even close. Here's my question for you. If that wasn't one of Trump's opposition points, would she have run on that? Because it's a big thing that she runs on. And would she still be running on it if it wasn't such a point? Because sometimes I think that I'm not saying it's not important, but would it be as important if he didn't? Just bringing that up. Okay, let's get back to this other part. Is that prescriptive drug prices? What's very interesting is that both the candidates talk about bringing down prescriptive drug prices, that they need to go battle with pharma about getting these done and bringing down the prices. Here's one of my questions that never comes up. Again, I talk about not only what they say, but also what they don't say. And what they don't talk about ever, and no politicians do, is they don't talk about Americans not needing the medications. They don't talk about us, you and me, being so healthy that we don't need the medications. By the way, if you don't need the medications, the prices naturally come down. You want to bring the prices down? Stop buying something, and all of a sudden, holy guacamole, boom, it goes down. I'm not saying that people should get rid of medications. I understand that. But as per the Kaiser Permanente group, the large insurer in California, statistically, they say that the average American, I believe, is averaging approximately 15 prescriptions filled per year. It was like 12 or 13. I think it went up to 15. So every single one of you, boom, 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 every single one of you is fulfilling 15 prescriptions a year. That number has gone up, and they anticipate it's going to go up in the next 2 years, 4 years. It's going to keep on going up. My question is, how can we stop that number from growing up? going up. How can we stop that? And when we do that, we then decrease prescription prices, but more importantly, we decrease the need for those medications. When are our presidential candidates going to put in a healthcare policy in which we care for Americans' health? I'm doing a talk in a short time in which I look at how much money it budgeted for healthcare in America, and I think it's like $4 billion. This seems like I hate to say this. That seems like a small number. I think it might be $4 trillion. Isn't it sad that $4 billion seems like a little amount of money? Say it's I'm going to say $4.1 trillion. 90% of that goes towards treating and managing chronic diseases. Look it up. Don't believe me? Look it up. That 90% of that budget goes to treating and managing chronic diseases. You look at that and go like, holy shit, are you kidding me? That's not only is that an astronomical number, but that means 10% of that budget is set forth to help people. How can we help people be healthier? How can we find a way to prevent the forest fire instead of always having to put it out? Why don't we do a Smokey Bear routine and start preventing the forest fire instead of trying to put them out the whole time? Why don't we just take one time our healthcare system? Why don't we look at this and say 10% of the budget is going towards prevention or getting healthier, while 90% is going towards treating and managing chronic diseases? Let me ask you a question. What the heck's going on? I find that absolutely astounding. Neither of the candidates talks about you being so healthy that you don't need medications. I think you should be so healthy that you make the prescriptions obsolete. I know. Rainbows and puppy dogs. I know. How great would that be? Let me bring a couple of last statistics for you. Last stats for you. What are the top two killers of Americans? Yes, watching commercials during presidential election season. That was one, because it makes you want to put pencils right through your eyes and jam them in as much as possible. It's incredible. The top 10 killers of Americans. These are the top 10 causes of death in the U.S. They're almost always the same. The only new one that's actually come in over the last, of course, 4 years has been COVID-19. But if we take that one out, still the top one and top two, even during COVID, the top one and top two were heart disease, number one, and cancer. In 2020, so this is 2024. In 2020, what were the top killers of Americans? Heart disease and cancer. Let's take a look at 2016. In 2016, what were the top two killers of Americans? Heart disease and cancer. So we put this together. In 2024, the top two killers of Americans, heart disease and cancer. In 2020, heart disease and cancer. 2016, heart disease and cancer. Where do either one of these candidates or their policies talk about decreasing those two right there? Waiting for an answer, waiting for an answer, waiting for an answer. They don't talk about that. You want to bring down overall healthcare costs? Give me a plan. Both of you candidates, give me a plan. Not about decreasing prescription prices, because that's not going to top. It's not going to come close to either one of those. Not going to even put a dent in either one of those. Give me a plan. Vice President Harris and President Trump, give me a plan that brings down heart disease and cancer in Americans. What's your plans on those? And their answer is, we ain't got none. Those two have been the top two killers. Heart disease and cancer have been the top two killers of Americans for decades. And they don't have a plan for either one of them. They don't have a plan for either one of them. How can you have a healthcare plan when you don't have a plan to attack the top two killers of Americans? How can you not do that? How can you not have a plan for that? I find it just stupid. Hey, we brought down drug prices on 10 drugs. We kicked pharma's ass. Pharma is laughing at you. So I'm going to give a grade. So if I was going to give a grade to Vice President, to Presidential-elect Harris and Presidential-elect Trump, my grade for Trump is a D. Why a D? Because he wants to once again eliminate Obamacare and all it stands for. And that's not the problem with it. Again, that's not my problem with it. My problem is that he doesn't have any plan to put anything into play when Obamacare is gone. That's my problem. You got to have a plan of something. You want Medicare for all? You want rainbows and puppies for everybody? Okay, great. It's a plan at least. You can't just eliminate a whole massive structure, a whole thing that is ingrained into the American healthcare policies. Eliminate it and not have anything to put into play. What do I rate Harris? D+, C-. Why? She has no plan. She has no policy, just as Trump, to take on and battle the top two killers of Americans. She has no plan for that. Trump doesn't either. And if you eliminate Obamacare, you sure as heck have no plan to do that. But she has no plan for that either. So, in 4 years, what do you think are going to be the top two killers of Americans? Besides pencils in the eyes of people watching, again, presidential commercials. Once again, watching presidential commercials. Are they brutal or what? They should have they should have a trauma ward for people who have to watch presidential commercials. So I'll say this to you. I've said it many times on my other podcast, the Empire Longevity Podcast, as I've spoken to a number of podcasts I've been on over the last couple of weeks, is that what's obvious in our healthcare system is that you as a American have to get healthy outside. Is that you have to get healthy. It's been very, very obvious. It's been obvious for years. But as I've been saying on the podcast, my live talks, in-person talks, is that you have to get healthy outside of the American healthcare policies. You have to get healthy outside of American healthcare system. If you want to get healthy, you have to do it outside of the healthcare system. That's the bad news. Here's the good news. It's really not that difficult. It takes work. It'll take focus. It'll take doing different things, putting priorities on over there instead of over there. It'll be different, but it's not hard. There's other countries that do it all the time. And they're much, much healthier than we are. And they spend a fraction of the money that we do on healthcare. I'm Dr. Otto Janke. I want to thank you for being with me tonight. And if you have any questions, comments, concerns, always feel free to private message me. I know some of you are not going to I didn't rub you the right way on this one. Sorry, I'm just going to tell you the truth. As I tell many of my practice members, I'm going to be the doctor that's going to tell you the truth. I might be wrong, but I'm going to tell you the truth. Anyway, I can help you. Please let me know. And We'll see you real soon on the Empire Longevity Podcast.